9 important things everyone should know about endometriosis. 1. Endometriosis isn't easy to diagnose. There are many women who go through a journey of visits to doctors and gynecologists without knowing the reason for their pain. They don't find out the reason. They are sick, have excessive bleeding, abnormal cycles, or even infertility. These symptoms can start with the first menstruations in adolescence. The only ways to diagnose endometriosis is with a pelvic laparoscopy or a transvaginal echography. 2. Very different symptoms. Endometriosis isn't only characterized by painful menstrual periods or infertility. Other associated symptoms are painful ovulation, pain during or after sex, abnormal bleeding, chronic pelvic pain, fatigue. 3. No, endometriosis isn't synonymous with infertility. This is important information for women who just received their endometriosis diagnosis. Suffering from this disease doesn't mean that you don't have the ability to be a mother. Among 30% and 40% of women with endometriosis won't be able to have children naturally, but with modern reproduction assistance, there is a greater likelihood of getting pregnant. 4. 1 in 10 women suffers from endometriosis. The Endometriosis Association gives us a lot of information about this disease that affects 1 in 10 women. They know that this is a chronic disease with unknown causes. They have been able to show, for instance, that there is a genetic predisposition. Among the things that can trigger the appearance of endometriosis, there are the following characteristics: premature first menstruation, regular but short menstrual cycles, less than 27 days, periods that last more than a week, late menopause. 5. Is this an inflammatory disease or an autoimmune disease? Endometriosis is an inflammatory disease that affects your immune system. But even so, doctors say that this isn't an autoimmune disease. 6. Not all women live the same way. Endometriosis affects each woman in a different way. In the first place, this means that one treatment won't work equally for all patients. There are women who don't have too many day-to-day problems. On the other hand, others need a catheter to urinate without pain. Others need to use crutches because they can barely walk. 7. Hormonal treatments, but they aren't a treatment in every case. Endometriosis needs estrogen to be present for it to be triggered. This causes the abnormal growth of this tissue. Hormonal treatments slow or stop the production of estrogen. As a result, they help. As a result, oral contraceptive pills are the most used treatment. 8. Endometriosis intensifies if you have a sedentary lifestyle. If you've been diagnosed with this disease, you need to avoid being sedentary. We know that when you suffer from chronic pain, it's very hard to leave the house, go to the gym, or take a walk. However, these symptoms intensify if you don't move. 9. The lack of understanding from those around you also hurt. You're always missing work. You have so many excuses. You're always complaining. It's like you're a glass doll. Everything hurts. You're weak. Always tired. I don't know why. You have such a defeatist mentality. These are usually the most common comments that women who suffer from endometriosis hear from those around them. Sometimes they get overwhelmed with relationship issues and the pain that some feel during sex. So, we're looking at a very complex disease with physical limitations and pain. The women with it also have to deal with social problems and the lack of understanding of or rejection from others. This disease needs to have better visibility. It needs better understanding and, above all, respect, sensitivity, and a good psychosocial support. This way, this disease won't be associated with solitude and rejection.